Could your blood pressure medication be causing your cough? And if I'm asking you this, you know the answer is yes. The class of medications I'm talking about in particular are the class of medications called angiotensin-converting enzyme inhibitors. Now, if you're saying, it sounds like a whole bunch of gobbledygook, well, let me tell you, you've probably heard of these names. Captopril, enalapril, Lisinopril, common one, Quinapril, Ramipril, another common one. There's others as well. It's like the medicines with the pril at the end, okay? These medications in particular can cause you to have a dry, hacking cough that often starts as feeling like there's a tickle in the back of your throat. And this is so important to know because I'll tell you, over this number of years I've been practicing, I'm approaching, I'm on the front side of getting to 20 years. In the next few years, I'll be at 20 years of practice. I can't believe it. Anyway, point being is, I see this, it's not uncommon. I see this with some relative frequency. And interestingly enough, statistics tell us that about 5 to 20% of patients started on an ACE inhibitor medication may develop this cough, okay? Or do develop this cough, I should say. Now, not everybody who's on this medication will develop a cough. Really important for you to know. The other thing I would say is when I use the pril medications like Lisinopril, Quinapril, etc., you're probably saying, yeah, I'm on that, but I don't have high blood pressure. Let me also just say, you can be on those medications for other reasons. We give those medications to people sometimes when they have kidney problems, when they have heart disease, when they have congestive heart failure, when there are other issues, okay, as well as high blood pressure. So don't just think, wait a minute, am I on the right medicine? So certainly talk to your doctors, but just know we do use these class of medications for a number of things. Okay, now, interestingly enough, the cough from this medication tends to happen more in women than in men, and it also tends to start relatively quickly after somebody starts this medication. So for many people, the cough will start like 1 to 2 weeks after starting the medication, but it can be delayed, according to many sources, up to 6 months. Now, I'll tell you this, though. I've had patients that have been on their ACE inhibitor longer than 6 months that have developed this cough. And sometimes that can be really difficult because you're sometimes not thinking about the medication because they've been on it and been stable for so long, okay? There's also the possibility that the patient wasn't paying attention to their cough and may not remember that they had it for so long. But just keep in mind, it can start, the cough, well after you actually started the medication. Keep that in mind. And as I said, not everybody who takes these medications gets the cough. Now, you're probably going to say, well, what am I supposed to do with that? Well, I'm going to tell you what to do about it. But let me, by the way, tell you why we think this happens, by the way. So we don't exactly know why ACE inhibitor, this class of medications, cause cough. There are a few theories that have been sort of put out there that are widely accepted or postulated, bradykinin and substance P, and a few other sort of techie medical theories, okay? But yeah, it's just kind of one of these things. So you say, I know you're like, well, so what am I supposed to do about it? Or what do people do about it? Well, to be honest with you, for many of the patients that I have had on ACE inhibitors that develop a cough, I'm often able to switch them to a medicine that I consider in many cases roughly equivalent for what I'm treating. Oftentimes that's ARBs or ARB medications, angiotensin receptor blockers, okay? And so that would be like losartan, valsartan, like those class of medications. And so for many of my patients, I just sort of swap them, and they usually do pretty good, okay? Because oftentimes the ARB medication, the ARB, tends to do a lot of the things that the ACE inhibitors do, okay? They're kind of a comparable class. Now, what I will say, though, is that there is a small percentage of people who are on the angiotensin receptor blocker medications, the ARBs, valsartan, losartan, blah, 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 that actually get a cough too, interestingly enough. Now, to my knowledge, I haven't had to stop an ARB, a medication in a patient because of cough, but I do think that's interesting that theoretically that can happen, okay? And generally, if you stop the ACE inhibitor, the cough tends to start pretty much right away. Like we're talking within days, okay? That cough will stop. So keep that in mind. I mention this to educate you, not for you to go home and diagnose yourself, okay? So this video is not to say if you've been having a cough for you to decide, I bet my cough is due to my blood pressure medicine or the Lisinopril I'm taking. That's not for you to do, because cough can actually be due to a number of things. It can be due to, your medicine, but it can also be due to acid reflux, seasonal allergies, lung cancer, so many other things, okay? So what you want to do is just know that, and reinforces pretty much everything I say in every video, if there's a symptom that's going on with you that's not right and normal, don't blow it off. Because a lot of times there is a reason for what's going on with you that we can help with. And that's what we want to do. I should also say there are plenty other side effects of ACE inhibitors. More videos on that to come. I have some other videos on that, but this one I just wanted to talk about the cough because it really can affect people, because that cough can be like just hacking cough, and it can be so annoying. So let me know if this has happened to you, if you've experienced this. Share this video with anyone you think might learn from this video, might be helpful for. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Please like and follow my page on Facebook, on YouTube. Please subscribe to my channel. Click the little bell for updates. Write a comment below. Share this video with other people. Also, follow me on Instagram, TikTok, WhatsApp, etc. at Dr. Jen Caudle. And go to my website, www.drjencaudle.com, to sign up for my free health newsletter. Guys, I'm Dr. Jen. I'll see you soon.